If you've ever felt the pressure of nailing your clinical exams, you're in the right place. I'm about to reveal the secrets and strategies that would help you confidently ace your clinical exams. So let's get started. So the first thing you want to do is to know the exam format and its components. You have to know the stations that are expected, the criteria for scoring, the timing, and every factor surrounding the logistics of that exam. Is it going to include history taking, physical examination, ethical stations, post encounters? Whatever the case, you need to identify everything that would come out in these exams, because for the different courses, the areas that they are structured to focus on sometimes may vary. So it's important that you identify the areas, know how much time you're expected to perform in the clinical exam, and know the scoring criteria. There are some parts of these exams that carry more weight than others, and wisdom will tell you that you should make sure you prioritize those areas and master them, because doing well in the low priority areas and doing poorly in the high priority areas may still amount to one failing the exams. So these are some of the questions that you want to ask before you go for any clinical exam. Number two, as much as possible, familiarize yourself with the common cases for that particular course. Before leaving any clinical class, there is an expectation that is hard of you, so to say. Now, and it would usually revolve around some common conditions. They are the outliers, yes, that may show up once in a while in the exam, but largely speaking, they are common things that would occur commonly. So make sure you familiarize yourself with those cases in and out. Sometimes it's unpardonable if one doesn't even meet up with the knowledge requirement for those kind of cases. So as much as possible, review patient cases, the common ones you see in the emergencies, the common ones you see in the wards, and know their entire management from history taking to treatment modality and counseling completely. This would help you prepare for the history taking stations, physical examination stations, and possibly write down stations as well in the clinical exam. You have to practice patient interaction. Now you have to do this in role play scenarios where you're either with a colleague, who I would call your clinical skills partner. You can be 2 or 3 in number, but 2 is preferred from experience because it helps you save time. So what you do is you practice all the cases that are known to come out in the exams, cutting across the different components. For history taking, physical examination, performance of procedures, whatever the case is, have a clinical skills partner from the beginning of your posting who you practice this thing with for the entirety of that posting until you get to a place of mastery. I usually tell students for clinical exams, I wasn't going to practice until I get it correctly. The idea is to practice until I can't get it wrong. And anytime I get to see maybe my breakdown or whatever, I'm usually happy when I see this course because it's almost reaching the maximum marks for those particular stations in view, and you just get outstanding. So make sure you practice, correct yourself over and over and over again until you can perform on autopilot and you can't get it wrong. That's the goal, that's the idea. Now you have to go for mastery. This is building up on what I just said, and the only way to master is to practice. Practice with your friends and then also go ahead to practice with real patients. Some things you may master from practicing with your colleagues, let's say maybe the speed, the sequence, but the actual skill sometimes may need you having someone with a clinical condition for you to master the skill that one may want to assess. Practicing with your colleagues and your friends can help you, but it's also good that you've practiced with a real patient on a number of occasions before you go for that exam. Because in the scale of proficiency, you always go through about 4 levels: ignorance, awareness, learning, and mastery. You want to make sure that you're at the point of mastery before you're going for your clinical exams, and this will only come by practice. You have to create a study schedule that covers the entire spectrum of what you'll be expected to know for the clinical exams. The entire spectrum, from the procedures you'd expected to know, the write-down stations, the history taking, the physical examination, the clinical reasoning, whatever it is for that course. Outline all the components and have a schedule that runs for the entirety of that posting to make sure that you leave no stone unturned. So do not forget, create a schedule that works. Familiarize yourself with the clinical guidelines for your institution or the globally recognized clinical guidelines because they are standard management protocols. Some of these you will learn by the bedside, you will learn from reviewing patient folders. You would also learn from these standard guidelines. So it's important that you have some of these guidelines that make your work relatively much easier. It's difficult sometimes carrying those big textbooks, the voluminous textbook, and you may get lost or feel lost while you're studying them. But they are these high yield materials that just puts everything you need to focus on in one place for you. And you have the guidelines, you use them, and you successfully ace that exam. So ask questions, find out from your senior colleagues, find out from your lecturers, are there clinical guidelines that you can make use of that would be of help to you? Make sure you acquire them. Now review differential diagnosis. For the common presentations, whether in form of history-taking stations or physical examination, it's always good that you have a list of differentials, about 5 for the common presentations. Don't forget, so have a hang of differential diagnosis, because if the question is not going to be asked on maybe the first diagnosis on your mind, you may be asked the question, what are the other possible diagnoses and how would you manage one of them? So keep that at the back of your mind. Anytime you see a presentation, a patient presents with these symptoms or this clinical sign was elicited, you have to know a list of common differential diagnoses for that particular symptom or that particular sign, or a cluster of symptoms and a cluster of signs. Make sure you know differential diagnosis. You have to manage your time well, and this starts from the time when you're practicing. I usually recommend practicing with 70% of the time you will be allotted on the actual exam day. So what does this mean? If your exam station is going to last 10 minutes, practice with 7 minutes. If it will last for 5 minutes, practice with 3.5 minutes. This way, you're certain that you'll be able to beat the standard time on the exam day, because there might be one or two logistical issues on the actual exam day. Maybe you're moving from station to another, having to calmly state your serial number. Sometimes you get stopped. Oh, repeat that serial number, repeat that mark number. In some instances, stuff like this would arise, and the actual time may now end up being reduced. So when you're practicing, make sure you practice with a time that is shorter or smaller than the actual standard time you'll be given during the main examinations. You have to stay calm under pressure. I understand sometimes that some stations may rattle you, get you uncomfortable, but you have to comport yourself. You're allowed to think in the OSCE exams. I know it's awkward, it's weird sometimes. You feel like you have to be talking all through. No, that's not the case. There's nobody pursuing you. As much as you have to be fast, so to say, there is room for you to pause when you lose train of your thoughts or you lose track of your thoughts. Pause and get back on track. Part of what the clinical exam is training you to do is to be able to think on the spot. Yes, for some of them, you're going to come and fire like an AK-47 and just get all the marks, check all the boxes out of the way. But there might be those questions that require you to think on the spot. And it's okay. Just stay calm, deliver as much as you can, and get as much marks as you can from that particular point. And one thing that will help you to do this is to always have a pattern. There is a spectrum of components clinical exams would come with. For all of them, have a pattern such that if something comes out that you are not primarily prepared for, the pattern can still just guide you safely up till the end. So that's something you want to do. Stay calm under pressure. You have to debrief and reflect. Every time you practice, either with your colleagues or you examine in the ward rounds, the clinics, be sure to ask your teachers, your mentors, your colleagues to critique you so that you can outline the areas that are common pitfalls for you or where you frequently make mistakes. Don't forget, you need the critique to be able to correct the wrongs and make right where necessary. It's always good with the way the world is going to have the ethical and legal aspects of the exams in view. Sometimes students tend to forget about this, and you might have 2 or 3 stations coming up in the exam that are surrounding ethics. So things like confidentiality, autonomous, non-malfeasance, beneficence, and all of that. Have yourself prepared for anything that might come within that area. I don't want to go into details for the specific courses and all of that. But make sure that as you're preparing, this is something that you're watching out for so it doesn't take you by surprise. Now, it's good that you engage in mock exams. So mock exams are okay. You can organize them by yourselves amongst your colleagues, or you reach out to those who have gone ahead of you to help you organize mock clinical exams that you partake in. It will give you an actual feel of the exam to know what the experience looks like, and it does something for you. Once you've gone through that, you can assess your level of preparedness, one, and also it will give you a confidence that you're not meeting this for the first time. Some departments in your schools may have something like this already set up, and that's the idea behind it, that you don't come and the first time you're doing that clinical exam is the first time you're having the experience. If it's not there, you can help yourself. So create a system whereby you have mock exams before the actual clinical exams. It will go a long way to help you. Always be patient-centered when you're performing your procedures, you're doing your examination, taking your history. You should be seen to be empathetic. Do not cause pain. Put the patient into consideration for everything you do. Even the stations that come as mannequins, treat them as real-life patients. Don't put your feelings as a priority before those of the patient. It's important. Always take a patient-centered approach. You're not just scored based on the particular examination skill you perform. You have marks for courtesy, you have marks for your approach, you have marks for your organization, you have marks for some of these things in the different stations, and you want to get as much marks as possible. Develop good clinical reasoning acumen, and this will come through practice. Review cases, make diagnoses, establish treatment plans, watch out for complications, and what this does for you is it enhances the speed of your reasoning, because you might have some stations where it is just like a paper with a question and then you have to quickly answer the questions. You might have to make a diagnosis, you might have to state investigations you will do. The more you do this before the exam, the faster your thought process will be, so that you can always finish every station, review your work, and you won't be spending 1 minute or 2 minutes trying to make a diagnosis and do everything else that follows. So make sure that you're good at clinical reasoning. The speed and the accuracy of your thought process you need to factor into consideration for you to do well in your clinical exams. Learn from your mistakes. As you go ahead, you get the debriefing from your seniors, your colleagues, and you reflect. There are some stations that you will notice common mistakes you tend to make. Once you see that station in the exam, quickly recollect, okay, this is a mistake I typically make when I'm practicing. On this day, I am not going to make the mistake. And before that day, of course, you would have practiced and practiced to see that that mistake doesn't occur. But on the day, be more particular. And once you get to that step, that particular part of the examination or the skill that you're being assessed on, be sure not to make the mistake. And it's also important that I point out at this point that it's okay that you sometimes code. Talking about having a pattern means sometimes you may have to have a code for either the examination skill, how you go about your history taking, so that it will guide you. Even when you are exhausted, you're tired, the bells are ringing, that pattern will just come to your mind. That outline that you follow will just come to your mind, and it will safely guide you till the end, and you will not miss out on those steps that other students may typically miss out on. There you go, you have it. These are the things you need to know to smash your clinical exams. So if you have questions, please leave them in the comment section. Don't forget to like this video, share with your colleagues, share with your friends, and subscribe to this channel. I'll be seeing you next time. I remain Dr. Gospel, the medic coach, and thank you for joining me.